My fellow Americans, it would appear that Obamacare is now the law of the land, referred to as the Healthcare Affordability Act. It should really be named the Healthcare Unaffordability Act. Yes, the president has single-handedly managed to take the best healthcare system in the world and fundamentally transform us into Europe. Perfect! What could be wrong with that? Right now, we have the best research and doctors and the best choices. And if you really get sick, your chances of survival are better than anywhere else in the world. But come on, who needs that? Well, for those of you who do not want to face a government death panel to find out if you're worth saving, there's still time to repeal this hideous bill. But let's say that it does get overturned. What then? We all know that politicians will feel compelled to do something. So I decided to commission a blue ribbon panel of some of the greatest minds in America. And of course, I turned to Hollywood.
Don't forget to dot the I's. Certainly.
And as you can see, I went right for the best. And oddly enough, they came up with better ideas than Washington. So here it is, the Chuck Woolery Healthcare Availability Act. Number 1, implement tort reform. Cut out frivolous lawsuits and defensive medicine, and you can reduce the cost of health care by 10% instantly. And while we're at it, let's revert back to when lawyers were not allowed to advertise on TV. We don't need lawyers on TV talking lazy, unemployed bums into claiming brain damage from a medical error. Trust me, you got the brain damage all on your own. Number 2, end state government-run health insurance monopolies. After all, you got to allow for insurance companies to sell across state lines. Allow anyone from any place to buy the best coverage for the money regardless of the state. Now, instead of only having a few choices, you would have over 1,300. Competition lowers cost. Just look at your cell phone bill and now compare it to 10 years ago. Number 3, reduce drug-addicted newborn babies. There's a drug-addicted baby born every hour in America at a cost of, catch this, $1 million per child. This needs to stop. Make it a form of child abuse, punishable by a minimum of 5 years in prison. When people know there's a tough consequence for their actions, many will change their ways. And at least those that break the law won't be making more innocent drug-addicted babies for 5 years. Number 4, create health savings accounts. Allow people to buy low-cost catastrophic health coverage and then put the money into a savings account for their everyday health care. Watch how prices drop when consumers start asking how much a certain treatment or procedure costs before getting it. Americans know how to shop, so let them. It'll reduce health care costs dramatically. Number 5, break the AMA hold on health care rules. Allow other medical practitioners to serve patients. We have a major doctor shortage problem, and it's only going to get worse when 30 million new users are dropped into Medicaid. Medicaid recipients can't find a doctor now. Imagine what it's going to be like in the future. We need nurse practitioners, physician assistants, and other health care providers to have expanded abilities to treat people. There is no evidence to show that this would diminish the quality of health care, and people would get treatment much quicker at a lower cost. Number 6, Congress and the President must live with and use the exact same health care system and coverage that they approve for the rest of us. Watch how that changes things. Number 7, the average American gets 12 prescriptions per year, an increase of 39% in just 10 years. Why? Advertising. Stop drug companies from advertising. TV commercials are convincing would-be hypochondriacs that they suffer from low T, ED, RD, ADD, COPD, AMD, and OCD, and my favorite, TMDD, which means too many damn drugs, syndrome. And who can forget those occasional side effects like, should you have an erection that lasts over 4 hours, seek immediate medical attention. Stop it! I know what to do with that, and it doesn't involve a trip to the ER. Save the $12 billion per year spent on advertising drugs and just lower my drug costs. Number 8, encourage real health care. Right now, we don't have a health care system, we have a sick care system. Our system treats patients that are sick. Let's get doctors better trained in nutrition and preventative medicine. Number 9, make people responsible for their own health. Do you smoke? Eat too much? Maybe huff a little glue, dude? Why should the rest of us pay for your bad habits? If you make poor choices, insurance companies should be able to raise your rates, not mine. And now, here's the frustrating part. Not only would these changes slash the cost of health care by 30 or 40%, Congress could implement them over a long weekend. So why won't they do it? Just follow the money. Too many lobbyists handing out too much cash. After all, it's not about what's best for the country, it's about getting reelected. I'm Chuck Woolery, fixing health care. So easy, even a game show host can do it.